Hi, now let's discuss about nuclear medicine. So nuclear medicine is an imaging modality designed to measure a F rather than structure within the body. So we are talking about function. So nuclear medicine is based on detection of radioactive molecules, which are unstable inherently, molecules that spontaneously decay to release radiation energy. For example, gamma rays or gamma particle. Now, this is being used as a major medical diagnosis or disease even therapy. So this become a more popular and very important, giving important functional aspect or metabolism. So how to create a nuclear medicine image? First, we do need a radioactive compound which can be ingested or inhaled or injected into the body. Then the radioactivity induced ionizing radiation that is optimized for human safety can produce an image. So before getting into nuclear medicine, I want to discuss a little bit of the spectrum of these ionized radiation. So ionizing radiation is a good example of X-rays and gamma rays. And let's see the spectrum. Okay, so the wavelength-wise, we talk about visible light as a 0.4 to 0.7 micron. However, if it's a shorter wavelength or from the energy point of view, higher photon energy is UV light. And then about 10 nanometer to 100 picometer and 10 picometer, you see there's a soft and hard X-rays. So the higher energy is hard X-ray. And after 10 picometer and even shorter wavelength, that's called the gamma rays. In terms of photon energy, you can see shorter wavelength has a higher photon energy. So visible light is, let's say, order of 1 electron volt, but X-ray will become 100 electron volt until about 100 kilo electron volt. And gamma rays has higher energy. So these hard X-rays in our daily life, we use it for like this airport security and medical CT. We are using about this range of electron photon energy and mammography and X-ray crystallography. So simply X-ray wavelength is about 10 nanometer down to 10 picometer. And gamma rays wavelength will be smaller or shorter than 10 picometer. And in terms of photon energy, X-rays usually have less than 100 kilo electron volt or keV, and gamma rays will have 100 kilo electron volt to about 10 mega electron volt. So these are based on our understanding of modern physics, and photon energy can be described as energy as nu or Planck constant times frequency in hertz. And Planck constant you probably know. And for this keV and this E stands for electrical charge of an electron, which is minus 1.6 times 10 to the minus 19th Coulomb. And in fact, you can use this formula to convert this wavelength into the energy. So there are a number of imaging methods using in nuclear medicine. So first, radioactive compound, we call it as, because it traces down the target molecule or process. So we call it as a tracers, and that is designed to reflect a particular function. For example, blood perfusion or metabolism. So by attaching these radioactive isotope to a molecule that participates in that specific function. For example, we can use iodine-131, which is a radioisotope that can, that actually, this iodine concentrate in the thyroid, so you can visualize thyroid. And highly active areas of the body uh, indicates the presence of the molecule. So a simple planar imaging and a little more sophisticated SPECT, which stands for single photon emission computed tomography. So this is more like X-ray counterpart, and this is more like CT counterpart in nuclear medicine. So molecules that are chemically linked with a, in fact, ray emitting element, as we say before, gamma ray emitting elements, and that's being used for the contrast agent. For example, technetium-99m is typically used for SPECT. And for planar imaging, we are using gamma cameras, so that gamma camera and also for SPECT too detects gamma rays, and that produces an image of a radioactivity from the target source. And we also call this image as a planar scintigraphy, and I'll explain you why we call it scintigraphy. So because gamma camera, on the other words, is called a scintillation camera, and scintillate means to emit light photons. So gamma camera is a device to image gamma radiation emitting radioisotopes, and that looks like this. So this is a camera which inside I'm going to talk to you a little more, and the patient might here, and this gamma camera can image. You will see the resolution is poor, but it has a very high sensitivity. So the application is early drug development and nuclear medical imaging to view and analyze images of human body or distribution of medically injected, inhaled, or ingested radionuclides, which emit gamma rays. Let's take a look at a few examples of this gamma camera images. So one can image head and chest, pelvis, and knees. So while the resolution might not be very high, but it actually shows where these tracers are present in the brain and the pelvis and the knee. So let's go a little bit deeper into gamma camera. So this is the schematic diagram of gamma camera. So those radioisotopes injected into the body, which will emit the gamma rays in these every direction, in fact, so that it starts with a three-dimensional location inside the body of the radioactive tracers in the organs, and that shines these gamma rays will go first through collimator. I'll explain what collimator is later. And then it goes through a special material crystal, which converts this gamma ray into a photon. That photon can be detected through light pipe, a PMT. Remember we studied PMT, which is relatively a big active area. So which means our resolution will be poor, but we can count the number of photons, which is proportional to the tracer concentration. And so through these electrons, we can create images. So that collimator is, in fact, usually composed of lead, which will block those gamma rays, which is obliquely entered. Only allows this linear gamma rays so that it can have a resolution of these and do not allow this oblique angle. So collimator used to collimate gamma rays in a gamma camera. And because of this final PMT size, the spatial resolution is very limited, about 5 to 10 millimeter. However, this gamma camera has a very high sensitivity. We can measure the amount of radio tracer down to several nanogram. And because there's no naturally occurring radioactivity, it has a very high specificity. So again, the scintillation is a small flash of visible or UV light emitted by fluorescence in the phosphor, when struck by a charged particle or high energy photons such as gamma rays. So let's study about this gamma camera, the version into a CT, which is very similar to when we create X-ray CT. So this CT SPECT is a single photon emission CT imaging. And this is how a good examples. So for example, we are interested in the function of the heart. If we are suspecting there's a myocardial infarct or the ischemic injury on some part of the heart, then we inject these radio tracer into the bloodstream and we take pictures through the heart. You see this, we can take this cross-sectional view and then SPECT scan images shows if there is area of reduced blood flow. So to create this cross-section, we need to have this 2D linear gamma camera. We need to rotate to take images in multiple different angles. And so gamma decay is high energy nucleus falling down to lower energy state and emits a gamma particle. So that's how we use as a contrast for SPECT. So we will discuss about PET, positron emission tomography next time. I'm going to compare this gamma camera versus a PET scanner. So gamma camera, as we see that the primary photons will be detected, and potentially there's because of scattered photon which happen to be collimated, could give a false location. Likewise, however, the PET has a little different scheme for because that in the PET is we are using a positron emission. So a positron is an anti-electron, and when positron comes out of radioisotope, it will hit in nearby tissues electron, and those electrons collide. Then annihilation is the disappearance, extinction of this positron and electron, while they generate two photons of the same energy, but exactly the opposite angle to preserve the momentum. So you can see that primary two photons coming exactly opposite direction, then you need to have all the detectors, the front and back, which measures the time difference to locate where comes the source. However, there's also potential of, due to scattering, we can have a little wrong positions can be measured here. So the difference of SPECT and CT we will discuss a little later. So next time we'll discuss about PET. Thank you for your attention.